PCOS and provide diagnostic and therapeutic approaches to the enigmatic heterogeneous disorder that is threatening to become a silent epidemic. For convenience, the topic is divided into two parts. Part 1 is about the epidemiology, pathophysiology, and clinical features of PCOS. And in part 2, I will discuss the diagnosis and treatment of PCOS. For clarity of understanding, please watch part 1 before viewing part 2. First, some historical aspects. In 1935, Stein and Leventhal from Chicago described 7 amenorrheic women with enlarged polycystic ovaries who resumed cyclic menses after ovarian wedge resection. 10 years later, in a progress report, Stein emphasized for the first time the association of hirsutism and obesity with the original clinical stigmata, and so defined what came to be known as Stein-Leventhal syndrome. Subsequently, the unique appearance of polycystic ovaries in women with this disorder has contributed to what today is known as polycystic ovarian syndrome. You must have realized that the condition is known by two different names like polycystic ovarian disease and polycystic ovarian syndrome. So which is more correct? The name polycystic ovarian disease (PCOD) is used when there is ultrasonographic evidence of polycystic ovaries. However, the term PCOS is preferred since in this condition there is a wide spectrum of symptoms possible and polycystic ovaries are seen only in 15% of women. The Rotterdam 2003 consensus criteria for diagnosis of PCOS are oligoovulation or anovulation, clinical and or biochemical evidence of hyperandrogenism, polycystic ovaries seen on ultrasonography, and exclusion of other endocrine conditions such as congenital adrenal hyperplasia, androgen secreting tumors, and Cushing's syndrome. Presence of 2 out of these 3 criteria after excluding related disorders is called PCOS. Out of the 3 criteria defined, hyperandrogenism has been regarded as the essential feature of polycystic ovarian syndrome. I want you to note one more thing about the definition. The diagnosis is based on 2 clinical parameters, that is oligomenorrhea or amenorrhea and hirsutism, and 2 investigations. The overall prevalence of PCOS in the general population is about 10%. However, about 30% of Asian women suffer from polycystic ovarian syndrome. The exact etiology of PCOS is as yet unknown, but it is considered a multifactorial condition. That is, both a strong genetic component and environmental factors contribute to PCOS. However, no specific genes or a family of genes have been identified that can cause or contribute to PCOS.